Welcome back. You know, when your heart skips a beat, could it be more than love? The answer is yes. It could be the most common type of heart arrhythmia, atrial fibrillation, or AFib, as it's often called. There's a reason we call it AFib, because it's easier to say. Joining me to explain AFib and heart palpitation is Dr. Tanya Tanawatawat. Did I get that right?
Yes.
Yes, cardiologist with IU. Good morning to you.
Good morning.
All right, the first question, because so many people want to know, what are heart palpitations and when, if at all, should you see a doctor regarding that?
People describe heart palpitation differently. Some people describe it as a pounding, a skip beat, an extra heartbeat, heart fluttering. It sometimes occur in your chest. Some people feel that on their neck or their throat. It can be occur during your exercise. It can be occur during you doing nothing. When to see the doctor, if you have any heart palpitation and you have some heart disease, if the heart palpitation becoming more frequent, get worsening, or is it very long-lasting, then we would recommend you to see the cardiologist. Or sometimes, if those heart palpitations occur in accompany with some shortness of breath, chest pain, or fainting, or lightheaded, then we recommend you to see the cardiologist.
All right, you talked a little bit about when you see them happening, what causes AFib or heart palpitations, and how can people know that that's basically what they're going through?
I see. So the cause of the heart palpitation can be varied. It can be just body response. When you have a rapid heartbeat, you can notice your rapid heartbeat when you exercise, having a fever, some hormonal change when people are pregnant or when they have menopause, or those can cause the heart palpitation. But sometimes the heart palpitation can be a sign of the serious problem. It can be due to the heart disease, or it can be due to the heart rhythm disorder. The most common heart rhythm disorder is atrial fibrillation. That also associated with a stroke. That's why we recommend that when a patient had heart palpitation, should be seen by the doctor in case if you have atrial fibrillation, then it can prevent the stroke in the future.
So how do you guys go about diagnosing it? And can a patient even diagnose their own in any kind of way?
So when the patient seen by the doctor, they're likely going to ask you what is the characteristic of your heart palpitation, how long does it last, how often do you have it, what kind of trigger that you have those heart palpitation, what you make it better. Those character of the heart palpitation guide the physician what type of abnormal heartbeat you have. Then when you go to see the doctor at the office, they normally do something simple called ECG. They basically almost like a snapshot of your heart rhythm at the doctor office. But if you show up in the doctor office and you don't have any symptoms, just like when you take your car to the dealership, you don't have anything wrong, then the doctor may put the heart monitor in order to detect the heart rhythm for a longer period of time. Then they can tell you that during you have symptoms at home, those monitor record that and send to the doctor to see what type of abnormal heartbeat it is. If it's atrial fibrillation, then they can start a treatment on that.
I'm curious to those watches that a lot of people wear. Are they any good? Do they tell you anything? What do you think?
I think the smartwatch have the algorithm that can give the alarm to the people that if they have a rapid heartbeat or they have atrial fibrillations. Some of the atrial fibrillation doesn't have any symptoms. So those people sometimes unfortunately presented to the hospital with a stroke, would they not know that they have atrial fibrillation before. So I would say yes, that smartwatch can be helpful, although it's not perfect because it's not, they may requiring more medical investigation before the definite diagnosis. Some of the smartwatch have the algorithm that they also can record the ECG. I would recommend that if you already purchased those smartwatch, take the benefit of those. If they have those alarm, record that, detect those, and talk to your doctor, show that to your doctor in the office.
So basically it can't hurt. Dr. Tanya, thanks for being here.
Thank you very much.
All right, good job. If you think you are at risk for heart disease or have experienced AFib, we're going to connect you with IU Health at fox59.com/links. Again, thanks for being here.
Thank you.